Even the biggest ideas start small. Those light bulb moments only become life-changing solutions when they have the brightest minds backing them. EIT Health powers up this innovation and entrepreneurship in health to meet the needs of our society. Driven by the rise of chronic disease and pressures of an aging population, our work is helping to solve some of the biggest health challenges in Europe. How? Our network spans the worlds of business, education, research and health service delivery to connect smart ideas with the smartest minds across borders. This unique ecosystem initiates new thinking and helps ideas take shape, whether that's a product or service, a startup, or by nurturing health innovators. Together, we're reimagining healthcare for healthier lives in Europe.
Welcome to Accelerate Your Innovation in Europe with EIT Health. We are really happy to be part of this session within the Sweden Innovation Days, and it's a pleasure to show our value and what we can do for you, for this vibrant community of innovators within Sweden. Today we will talk about who we are and what we do, really simple, and then we will discuss a case. So we will talk about a case of the Swedish and French Accelerator that we created together with Vinnova to help Swedish startups to enter to the French market. And we will hear also one case from a startup that went through the process, Worldish, and they will be also presented today. And then we will go through the opportunities that are there for you as innovators within education, within innovation and accelerator to help you with your businesses and with your innovations to reach the market. Finally, we will also see a case and a successful case that we supported and we created actually in one of our programs. And finally, we will end up with some Q&A session for you. Welcome to EIT Health Scandinavia. This is the team, my colleagues in Scandinavia that are in charge of bringing the knowledge and the links with European Commission in innovative ecosystems to the Nordic countries, including Sweden, of course. And what we do in EIT Health, we do it because we have a vision to empower citizens to protect their own health and improve healthcare systems through education, innovation, and also accelerating technology and creation of products to the market. And our mission as an organization is to become Europe's largest innovation network in health by 2030 and facilitate longer, healthier lives, of course, of every one of us in Europe and make more sustainable healthcare systems. Who we are currently already the Europe's largest health innovation network. We have more than 130 partners all around Europe, including a lot of them from Sweden, of course. And we are a EU-funded organization, so one of the organizations under the European Commission and or under Horizon Europe to deliver innovation in Europe. We are a non-profit organization, and we mobilize health innovation agents across Europe. And this is our main task as an organization. To facilitate the pathway to different European markets. We do have our central office located in Germany, in Munich specifically, and then offices all over Europe with many colleagues as well that are there ready to help and support innovations to go cross borders. You see here the list of offices that we have all over Europe, and our office in Scandinavia actually covers the Nordic countries and the Baltic countries as well. So what do? We build credibility and awareness internationally for all our partners, more than 130 partners across business, research, education, and healthcare delivery. We facilitate international health innovation networks and projects to connect to each other. We also have a section or a pillar which is taking care of training and upskilling students, entrepreneurs, but also healthcare professionals. And we also support health innovators in the development of their ideas and take them to the market. Finally, we also play a role on the policy, and we do run regularly think tanks, forums with industry thought leaders that will shape the future of the policy in Europe. So why do we do this? Is to improve the effectiveness and sustainability of the healthcare systems and the life of everyone in Europe. As I said before, we are a large network of innovators. Our partners are any organization that is working or leader in innovation in Europe is mostly part of EIT Health. We have all the leading organizations of Europe, from corporates to academics, cities, regions, research centers, catalyzers, hospitals, incubators, tech transfers. Everyone, as I said, that is involved in health innovation is probably part of EIT Health, or it should be part of EIT Health community. We are focusing from last year in 4 main areas that we have identified together with our partners and together with the priorities at European level. And those 4 flagships that we call are those that you see on the screen. So facilitating the uptake of digital medical devices and diagnostics. So we are pushing towards a unified market access for reimbursement of digital medical devices in Europe, which currently is quite fragmented, as you all know. We also are supporting the full potential of health data for innovation and the development of the European health data space that the European Commission is pushing to develop, and we are running or supporting many initiatives around those topics. We also have one of our focus areas, one of our flagship is regarding the new models of delivering healthcare, because we believe that we need to change how healthcare systems are working to make them more sustainable. So we are pushing to include patient-reported outcomes and value-based to all the projects that we support on this area to change the paradigm of healthcare from a more reactive perspective to a more preventive point of view. And we also are, one of our focus areas is on supporting the deployment of important projects of common European interest on health specifically. And this is what we are focusing for the last year on in EIT Health. Within this, we have developed and we are running many projects, and we cover all the technology readiness levels from the beginning when you have an idea and you need to set up, to validate that idea and validate the business model. So we have education programs that are targeting those people that have ideas, or changing the mentality of those that might have ideas to bring to the market. And we also have boot camps from the accelerator that are going to help some of these innovators that are ready to prove and try their idea. We will talk about the patient innovation bootcamp later in the video, and you will see one of a beautiful example of a solution that came from a patient, actually, a family that had a problem, obviously, and an idea. And but there are many more others projects that you should have a look if you're in this level. And then once you are on a level where you need incubation, you need support, mentorship, you need validation and testing and training for your entrepreneurial skills. We also have projects in that level. And then once this is all set up, we also have the accelerator projects and the innovation calls that will support and bring access to funding and consortia and partnership that you need to validate at clinical level, for example, your solution, and we'll help you to collaborate with world-class leader experts and give you opportunities to increase your network and possibilities. And then after, we have programs as well when your solution is at more mature levels where you actually need to start sales on different markets in Europe, or you're ready to make the jump to the international markets, global markets. And then we do have also programs in that giving you access to venture capital or investments later on. But you will hear about all these opportunities later on by my colleagues. So basically, by now you might have an idea of what we do. We basically have 3 pillars. So one is the accelerator, which is taking care of all the startups, training and needs that they might have to reach the markets. Then we have a lot of efforts on education at all levels. So from citizens and patients to healthcare professionals, students, of course, innovators, PhD students, academics, to also executives and leaders. So this is also, we believe, really important for us. And we do have innovation calls where we finance projects that are collaborative projects that are able to move the innovation from one country to another country in Europe and retain the innovation within our European countries. So I want also to invite you, if you have ever participated in any of our courses or events and so on, you are actually entitled to join the innovators community that we have. Nowadays, there's more than 2,500 active members in the network, and is increasing at the exponential level, the amount of people that are joining, and then you have different benefits of becoming part of this exciting network with exclusive job offers, maybe internships and opportunities, mentorship, workshops, invitation to different events and opportunities to network with different partners. So I think it's a great opportunity, and I want to invite you to join the innovators community. And finally, I want to put on the screen the value that we bring to path the way to European markets, knowledge, finance, and regarding the stakeholders. So if you become part of EIT Health, you're part of the Europe's largest health innovation network. We do have a network also of testing facilities and validation. We have regular networking opportunities, matchmaking events, and then market and patient insights from more than 2,500 experts that are within our network. We also have access or influence in policy making within EU for decisions at EU level, and as well as competitive funding opportunities. So it's a great opportunity for you to be engaged with us and have a look. We want, we detected that, innovations usually are created in Europe, but then they go to more favorable markets outside. And what we want is actually to retain this innovation, and that the innovation that is created within our institutions is also reaching our patients and our citizens. So we want to collaborate. We want that an innovation that is happening in Portugal, for example, is implemented in Sweden, in Norway, or in Italy at the same time, so we become a more stronger society together. So I will invite you to get involved in different ways. So one is becoming a partner if you are an institution that wants to take part of this vibrant community. I'll also invite you to be involved in our network engagement events, webinars, roundtables, focus groups, matchmaking, and etc. And then I will ask you also if you want to join us to take our calls and participate and create consortia within our partners to access to our funding and our opportunities as well. Then I want to present one case. So this is the case we created, or we worked with Vinnova together to build up a Swedish and French accelerator that was going to target, that did target, in the past, AI and digital health solutions from Sweden that want to enter to the French market. And we had 9 months time frame for that accelerator with 7 specific goals, which was the international development of Swedish SMEs and companies, foster cross-border tech and business partnership between companies and institutions, and also making bilateral collaborations in digital health and also in R&D project partnership, increase the knowledge areas within R&I in business between Sweden and France, and also share an innovation culture between France and the development skills to run joint projects. So what we did actually is select, I think, 10 startups from Sweden. We made a 360 degrees need and assessment where we identify the individual needs of each one of the startups and also the common needs that they had. And we did organize a series of sprint sessions with the EIT Health experts to address the main topics that they were assessed to enter to the French market, for example. And also we combined that with experiences from startups and other previous entrepreneurs that did the same pathway. And we increased the connection made in France, not only focusing in Paris, but actually on the whole country. And then individually, we created a tailor-made pathway to address the specific needs of each one of the startups. Here are the four sprints that we created with different members, so different institutions within France. And you see here, the first one was about putting the context of digital and AI in France for the Swedish companies. Also, the innovation and healthcare systems and ecosystems within France was presented in the second sprint. And then the regulatory differences between France and Sweden, which we believe was of really good help. And then EU and national French support and financing opportunities that are there available for the startups to move to the French markets. Here you see some of the startups we supported and that we are really proud that they have started to enter in the French market, most of them, with one exception. You are more than welcome to explore what they're doing, these really successful companies that we supported in the first round of the Swedish and French Accelerator. And with this, I'm going to just introduce and give the floor to Worldish, one of the startups of the Swedish and French Accelerator that we ran last year. Thank you so much for the interest. Thank you for listening to us. And you're more than welcome to get involved and contact us if you need some support. Thanks a lot and enjoy the rest of the sessions.
Hi. My name is Abhishek Jacob. I'm one of the co-founders and the CEO of Worldish. Worldish brings you the world's first multilingual communication assistant for healthcare and welfare called Helen. And today I'm going to take you through Worldish's journey through the EIT Sweden-France Accelerator program. So Worldish solves a very important challenge, communication barriers between caregivers and patients. Because there's not enough standardized communication out there, we don't have enough interpreters, tools to communicate. We have a lot of foreign caregivers in today's world with foreign talent. And on the patient side, we have patients with language barriers. We have patients that don't understand complicated medical terms. We have patients with other kinds of disabilities, communication barriers like functional disabilities. And all of this can result in a high risk of wrong medical decisions, a threat to patients' health outcomes, and in worst case, even death. And this is a problem that we would like to solve at Worldish. And to solve this, we created Helen. So Helen is a unique multilingual communication and training assistant because it develops and it facilitates deep medical dialogue in more than 60 languages. It's powered by multimedia and machine learning technology. It's interoperable with different tools and medical systems. And Helen is the ultimate communication assistant for healthcare for the future. Why we're here and what we try to accomplish with Helen is medically verified communication in all the languages, in all different healthcare situations, and also to train caregivers in their medical communication, be it with an elderly care, a foreign caregiver, or a new caregiver who needs communication training. And through Helen, we can increase the quality of care, increase the patient safety for everybody, and by the improvement of quality, we can reduce a lot of direct costs related to interpretation, direct costs related to translation, related to unnecessary healthcare visits because of misunderstandings, and a lot of other indirect costs as well. And research shows that increased quality of care through efficient communication can lead to significant direct and indirect cost reductions. Worldish is based in Sweden. We have a multicultural team and also a very diverse team in terms of competence and experience, both in terms of innovation management, medical science, language technology, public health. We have a diverse group here, and we started our journey in Sweden about 5 years ago. And we knew right from the beginning that this is a global challenge that needs to be solved in Europe and to the rest of the world. And after Sweden, we decided to take Helen to other areas, and we looked at the EU market as a whole. And we stumbled upon France, and you may ask, why France and why now? So, as there's increased migration and increased globalization in the world, we see a lot of foreign workers, a lot of foreign communities, a lot of foreign patients in different healthcare systems. We see a lot of foreign caregivers in the elderly care, social care settings. But also from a health system point of view, we see there's an increased focus on digitalization in healthcare. There's a lot of increase in digital health initiatives by the government. There's a lot of more budgets, more development funds allocated for this sector, especially in France over the past couple of years. And there's also a rising cost awareness, not just in France, but all over the world, especially in healthcare, that healthcare needs to be more available, needs to be more cost efficient, needs to be more individualized, more personalized for patients. So there's a lot of focus on efficiency and cost control in a good way. So putting all of that together, we felt like this would be the perfect time to accelerate Helen's internationalization outside Sweden. And with the program that EIT and Vinnova designed together, we thought it was perfect as a launch pad for us into the rest of the EU. So a bit about the program and the support we got. So it was a fantastic program that was designed for us and the other Swedish startups. And what we got, the support that we got from the program was understanding of the French health tech market, which meant that we were able to understand how the French healthcare ecosystem worked, how different healthcare providers are set up, what are the norms, what are the regulations for digital health in this country. And connected to that, we were introduced to the innovation support ecosystem. So we met different private and public organizations that help companies in digital health, help medtech companies to navigate in the system, to do market analysis, to do introductions. So that can help us in our recruitment, team building, registration. So we met several innovation support actors in the ecosystem. And we also had tailor-made master classes from successful French health tech startups. And these are master classes about how their journey went about in commercializing their innovation and scaling up their organization in France. So it really gave us a lot of practical insights and also helped us to grow our network, learn from people, learn from the doers. So that was a really good first-hand experience. And we also got some good marketing and exposure to some of the French care providers, university hospitals. We also were part of different investor networks, investor meetings, startup fairs. So we met a lot of actors, part of the startup ecosystem in France, especially at Station F. So it opened our eyes to, what the French startup and the health tech ecosystem can offer us. And of course, it helped us improve our visibility being a Swedish startup in France. As we progressed through the program, we really achieved a lot of our goals. Initially, we wanted to, be more visible. We wanted to, kind of test the market, test the waters with Helen, and look at the acceptance and the probability of success. Through meeting all these stakeholders, we engaged in a couple of different projects, and as a result of these projects, these are the results that we've got from the program. So Worldish got access to relevant market access consultants. So they helped us in market analysis. They helped us in connecting us with the biggest hospitals in France and getting opinions from key stakeholders, key doctors, key users about the viability of Helen, about the market product fit of Helen. And through that, our product, Helen, has been verified as a market-ready and a market-fit product by 5 healthcare organizations in France through these projects. And after that project, 2 of the hospitals, part of the biggest healthcare hospital network in France, APHP, have confirmed to pilot Helen as well. So it's really a very promising start for us through these projects to see that there's actually a real need, and there's a keen interest, there's a sincere interest to launch our tool in France. And we also, through the partners and the discussions, we also found a commercial health tech expert to join our team, who will be leading our France commercialization activities, who will be helping us to build our team in France. So we're really excited about that support as well. And currently we are planning to set up a local presence in France so that we can be closer to our customers, so that we can understand the market more, so that we can adapt and customize the tool according to the French healthcare system and to the French needs and culture. So we really look forward to that, and we're in early stages, but we, together with the partners and together with the support ecosystem that we have in France, we really hope that we can achieve this quite soon. And last but not least, we were so fortunate, part of the program, to introduce Helen to the Minister of Health of France. And this happened right at the very end of the program, on the conclusion day of the program, where we had an opportunity to quickly demonstrate Helen for him, and it was a very warm welcome, and the very the very openness of the minister towards us and towards Helen, showed us that this is a country that is really positive towards innovation and foreign startups. So it was really a great pat on the shoulder for us, and it was a great testament, to the whole accelerator program that was set up by EIT Health and Vinnova. We were we are totally grateful for the whole program, for the traction it has given us, and especially for a startup that does not have a lot of resources, having this kind of program to support, with the network, with the knowledge, with the key actors, and the marketing visibility as well, has really helped us in moving one step closer to take our business international, and also to create a more global impact of Helen and Worldish. So we truly recommend this program to all other startups in Sweden, and if other countries and other startups part of the EIT network can also participate. It's a great program, and we totally recommend this to anybody who wants to enter France, especially the health tech ecosystem, and want to be introduced in the best way possible. And we totally look forward to establishing Helen in France, and growing the Worldish team in France, and also, to the rest of Europe, and, France being our first major EU market, and then, use France to extend to the rest of the world. So I thank you all, and wish you a great, fantastic, inspiring Innovation Day in Sweden. Thank you.
So thank you for sharing your story. My name is Matilda Wennerholm, and I work with education at the EIT Health Scandinavia. I'm also happy to be here today to be able to present a little bit more of what we do in education. So I will speak about the role of education and innovation, a little bit about the flagship call that my colleague just mentioned, also the higher education initiative and the deep tech talent initiative, as well as some examples from our portfolio that our consortiums that we invest and support are creating together with us. So just the short agenda. But I would like to start with, as I said, the impact of education in innovation. Education brings the gap, or bridges actually, the gap between academia and the business side. As you can see in the knowledge triangle where we are operating, new knowledge is the source of innovation. Skills are a key input in innovation, and knowledge for new market development is also important for education, as well as skills are a key input in R&D. So you could conclude that all of these transactions between the research, the business, and education pillars are very crucial to operate and centered around education. So we engage learners across society in the entire health ecosystem, from citizens and patients to both healthcare professionals as well as entrepreneurs. And so far, we created great impact by EIT Health and the education that we have been providing by our partners and network. So there are huge numbers in terms of citizens that have improved their lives, as well as number of graduates and professionals trained. So education is all about skilling, reskilling, and upskilling. And what we are aiming for in EIT Health is actually the lifelong learning education for all actors in the ecosystem. It's important with innovation adoption, and it's also important with innovation development. They go hand in hand to be able to increase knowledge, to provide skills, to apply innovation and entrepreneurship, but also to be able to disseminate the knowledge as well as create an uptake of innovation. It also goes to generation idea, to project execution, boosting capacity, as well as entrepreneurship and innovation skills and competences. And as I mentioned, we have a wide span. The target learners, as I mentioned in the previous slide as well, as you can see, it's a very holistic target learners, and the format that we are offering is everything from fellowship program to winter summer schools. We also have the degree programs from master at PhD level, but also non-degree training modules for professionals, policymakers, patients and citizens, NGOs, etc. And then we have a huge number of MOOCs as well in our portfolio. As said, right now we have this huge flagship call centered around a few pathways, from new models to deliver healthcare to digital medical devices, as well as health data for innovation. And here you can see the highlights for the education modules that we are calling for these three pathways, and they are all available for the cutoff in June, as you can see, the fellowships and also the training modules for patients and professionals specifically. But do reach out if you find this of specific interest, and we can start a dialogue connected to that. Now I would like to speak about the health education initiative in higher education, HEI, and the relation to deep tech. So this is a higher education initiative that is part of the European Horizon Europe under the European Strategic Innovation Agenda. And it's expected, since it's involving all of the knowledge innovation centers, it's expected to raise the bar essentially in education. It's a capacity building higher education initiative with the ambition to engage at institutional level a couple of hundred academic partners. And the reason for that is that we see this initiative as a very strong way forward to strengthen the entrepreneurial and innovation capacity at the institutional level, but also to strengthen the innovation and integration of the ecosystems. And last year, when the Deep Tech Talent Initiative was launched, which is aligned with the new European Innovation Agenda by the European Commission, this initiative is accelerating now for the coming 3 years, and it has an ambition cross-European to upskill and reskill 1 million learners and talents in the coming 3 years by developing and scaling training and learning modules and programs specifically in deep tech. And the EIT Higher Education Initiative calls includes now in the latest call a deep tech focus, specifically in order to foster these new deep tech talent that are so much needed and are so important to the future development of innovation in Europe. And already now there is a deep tech talent education platform available, as you can see, with all the innovation hubs connected to that, from EIT Health to digital, energy, manufacturing, etc. So there is a huge program available already now online where you can connect to these courses. And for EIT Health, we have, for example, this Hello AI, which is a platform and a course introducing AI to medical professionals. And you can apply in the link below. It's published. So finally, a few examples from the professional as well as the entrepreneurship education from our portfolio. I will start with the professional education. And this is a huge initiative called the Healthcare Transformation Academy. It's an initiative that is created together with our partners and together with the European University Hospital Alliance. It's all about catalyzing a scalable, continuous education to upskill healthcare professionals in terms of the healthcare transformation by innovation skills. And actually, about 70% of healthcare professionals, they do not use digital solutions due to lack of knowledge and skills and training in data and data analytics. So this was a huge effort and consortium created to fill the gap of continuous education in healthcare with the focus of healthcare transformation and linked to specific needs. The education is offering an affordable cross-healthcare professional and professional background, as well as hospitals. So it's a platform that is including multiple partners in the consortium, from industry to academia to hospitals, as well as research institutes. And the Academy is offering multiple courses within this transformation space. So we have courses in innovation management, leadership, high-value care, as well as digital health transformation, and also precision medicine. So you can apply and enroll as you wish in the link below. But we are very happy about this Transformation Academy. It's customized, it's delivered to the needs based on the actual needs defined by healthcare professionals with the patient-centric point of view, as well as it's flexible, it's targeting all over Europe and all kinds of healthcare professionals. Now I would like to switch to the entrepreneurship education and the target group of entrepreneurs and startups and so forth. For example, but it's still within the academia. So this is a course, it's called Be Healthy. It's for biomedical engineering students and health systems focused. It's a one-year innovation PhD module that applies. There are 2 tracks, and there is also a fast track, you could say. So it's targeting employees from the industry or from the healthcare sector to support this lifelong learning. And as you can see, there are multiple partners involved as well, from academia to hospitals, regions, and industry. And it contains different kinds of modules, from entrepreneurship training to workshop on intellectual properties, regulations, etc. And also some study visits and practice and hands-on with the partner visits. And then we are also this year launching a summer school together with a number of partners, again from the industry and academia all over Europe. It's called the Top Female Founders. And it's actually focusing on the next generation of female founders, innovators and startups. And it aimed to equip the female participants with tools and methodologies for developing an entrepreneurial venture, social enterprise, very connected to the healthcare system and the patient centric view. And it's also about connecting female leaders, the academia and non-academia partners to all together build a stronger innovation ecosystem in Europe. And the enrollment is about to start in April, so stay tuned for that. And then I also want to mention, but I think my colleague might have mentioned this already, we have this huge community of innovators. It's called the Innovators Community, with a number of members already where you can connect. There are trainings, networking opportunities, events, even job opportunities. So please get connected with EIT Health also at this community network. Thank you very much. I would like to hand over to my colleague Per, who will talk about innovation and business creation as part of EIT Health. And do reach out if you have any questions. Thank you.
Hello, everyone. It's a bit odd to sit here in front of a computer recording a presentation and not actually giving it in person. But nonetheless, thanks for having us here. And my name is Per Horn. I'm Entrepreneurship Lead and Regional Manager at EIT Health Scandinavia. And I'm here to tell you about some of our programs, particularly within innovation and business creation. We have a focus on 4 flagships, what we call flagships. These are areas that have been identified as priorities on an EU level, as well as by our partners. And today I will focus on these 3 flagships: facilitating the uptake of digital medical devices. This is a fast-track program for digital apps, particularly in Germany and France. And then we have a flagship called harnessing the full potential of health data for innovation, in recognition of all the data that is out there and pretty well organized everywhere. In Finland, Denmark in particular, we have solid databases and integrated databases, and we just need to have access to that in order to really increase innovation. Then we have new models to deliver healthcare, which is transforming healthcare one way or the other by diagnostics, by better treatment or even less treatment or prevention of diseases, focusing in all cases on patient outcomes. Now we have our innovation calls. These are the big calls. They are clustered into 3 cutoffs. The 2 first cutoffs are over. Deadline for the second cutoff was March 1st. The third cutoff has a deadline on June 1st. And here you can see what kind of programs we are offering within these flagships. Modules toward a label fellowship program. It's an education program. And then service quality assessment call for projects, and that falls under new models to deliver healthcare. And then we also have within the other flagships a module towards label fellowship programs, and then startup and partner-driven projects across all 3 of these flagships. Similar for harnessing the full potential of health data for innovation, we have module toward a label fellowship program, as well as startup and partner-driven projects for all these 3 flagships. In business creation or our accelerator programs, we distinguish between early stage engagement and later stage engagement, or exit scale-up engagement. For companies that are at the development stage or beyond and have a proof of concept or proof of feasibility, typically the team will also involve a patient, often with an idea or creativity that is relevant for a particular patient group, and a healthcare professional. Such teams are welcome to apply for our patient innovation bootcamp, where they get market fit validation and also help in creating a business model, and pitch the solution, training for that, so that you can reach the next milestones. We also have the regulatory pathways to market bootcamp, also targeting early stage, TRL maturity level 3 to 6. And here you will get to know about the regulatory route of approval, go-to-market strategy, and get hands-on experience and meet similar-minded people in order to bring your solution to the next level. Then we have a wildcard. This year it's about children's health. It targets entrepreneurs, potential entrepreneurs, late-stage academic research, startups, SMEs, and there are some requirements. You need to establish a company if you don't already have one, and you will receive training and mentoring from experts, and you will be taken through the whole process of validating your problem, solution, product market fit, and you pitch for a chance to secure investment. And all this support is coming from EIT Health in terms of access to mentors and stakeholders. There's a webinar on the 23rd of March. You might be able to catch that. Then we have the user validation labs, also for early stage companies with a product or service in the development phase, but not in the commercialization phase. And here you will get access to living labs, accelerators, hospital innovation centers, catalyzers, as we call it also. And then you will get the support that you need to validate your solution. It could be an algorithm or some other. And there's also a webinar on the 23rd of March. And then we have our mentoring and coaching network, which you can apply for all year round with a specific problem in mind. That could be regulatory, clinical, developmental, business. Actually, there's no limit to what problem you want to solve. Then go ahead and apply for mentoring and coaching network, and you will be put in contact with people or experts who can address your specific needs. And there's also a webinar there on the 23rd of March. And now we go to a little bit more mature companies. Then the catapult is excellent. Here you get a deep dive, and you get super mentoring. There's a little team around your team that makes sure that you continuously sharpen your business plan. And during the program, you will be exposed to investors and corporates and lots of networking opportunities. There's also a little prize money attached to the winner. And here you can see the requirements. You need to be incorporated in a EU country, and you need to be looking for seed or Series A funding of at least 500k euros. And there has to be a self-valuation of 1 million euros, and you need to have received some kind of financing from either public or private funding sources previously. There's a deadline on the 2nd of May, so plenty of time to apply for that if you really want. This is one of our flagship business creation programs. And another one of those is our Bridgehead program. The Bridgehead program is designed for companies that already have some traction or sales in their home market and wish to expand or enter another market. And we have run this program with high success over the years. So it's a 1-year program, and you get introduced to all relevant stakeholders in that country you wish to enter in, and there's a little bit of funding coming also included in the package, but also expenses are paid and so on. So you get networking opportunities, and you get people around your team who can actually pave the way for your market entry. It's a very interesting program for companies that have a health tech solution on their home market already. You can have a view of all our programs on this link. And then before I say goodbye and thank you, I will like to show you how EIT Health has helped a company called Beal Glasses to realize their idea through our patient innovation bootcamp. So enjoy and thanks for listening.
Biel is a very happy child. He enjoys running or going to the beach.
Niño encantador, tranquilo, simpático, era un encanto.
We realized that Biel was having a problem when he was 2-3 years old.
En realidad los problemas se empezaron a notar cuando no podía hacer lo que quería.
He was falling all the time. We didn't know what was happening, and we visited many doctors. At the end, we realized that the problem was in his eyes.
Para mí, como madre, descubrir lo que pasaba con Biel fue desesperante, fue una tristeza horrible, fue un momento muy, muy duro.
Biel has a kind of condition commonly known as tunnel vision. He has quite a good sight in the center of his vision, but he has problems for seeing around, and this is why he runs on obstacles and he easily falls. Low vision is when you are not completely blind, but you have visual impairment that do not let you do the basic daily task and cannot be fixed by normal lenses or surgery. There are more than 70 million people in the world with mobility problems caused by low vision. All parents feel their responsibility at least to do the most for a child with a disability.
Creo que al final, como muchas madres, al final lo que hacemos es levantar la cabeza, salir adelante y buscar herramientas para poder ayudarlos y que tengan una vida plena y feliz.
When you realize the health system will not offer you a solution, then the last option is that trying to make a solution yourself. In the beginning, I didn't know all the details, but the basics using a combination of artificial intelligence or 3D vision to make this adaptation was quite strange to me. If doctors or medicine was not able to improve his sight, technology could at least improve his life. Our product is called Biel Smart Case. We are in the first version of the product. It uses 3D vision and AI to understand the reality.
A ver, cuando yo utilizo las gafas, lo que logro ver es, en principio, una flecha que me indica que hay un obstáculo. Cuando yo logro enfocar mi campo visual hacia ese obstáculo, veo un círculo que me indica que realmente allí hay un obstáculo y luego pues lo esquivo. Gracias a la flecha primero y luego al círculo.
The goal is to allow the patients to be independent and to go anywhere that they want to go without the need of nobody accompanying them. In the beginning, there was nothing but parents with a need. We started with our own money. It was very hard. EIT Health was one of the first institutions that helped us. The bootcamp helped us in different aspects of developing startup. There was a possibility of talking with other patient innovators, which was very important. When patients try to find solutions, it's because the health system is not providing them. Patient innovation is becoming something important in the whole health system. We had this idea in 2015. It took about 5 years, and we achieved the approval as medical device. We expect to release a new version on 2024 that will include navigation capabilities and 5G. The way that we are working is unexplored. We are making the way. What we hope when Biel grows as an adult is that he can use our glasses to do whatever he wants. We have the opportunity to really change completely the lives of people with visual impairment.